I am Dr. Kiran Kumar K, consultant psychiatrist and director of the Nirvana Center at Marathahalli, Bangalore. Postpartum period in a woman is a very fertile period, and there are enormous changes that are occurring in the body, be it biochemical changes, be it endocrinological changes, be it emotional changes, be it social changes. So the women are vulnerable at this time frame. But one of the commonest myth in general is patients or women in their postpartum period or even during their peripartum period are not vulnerable to psychiatric illness. Unfortunately, it is false. Patients or probably clients in their postpartum period are at 5 times more vulnerable to psychiatric illness than anybody else. The reason for that, the postpartum women has a lot of emotional changes, anticipation of a child, what are the social reactions, excitement, fear, what is going to happen, will I be a good mother, how is the bonding, etc. And along with a lot of genetic and biological changes, if they are vulnerable, they are bound to have psychiatric disturbances. So postpartum period is a fertile period. They have a risk for increase in outcome of psychiatric disorders. Now, what are the common psychiatric disorders that we see in the postpartum period? Traditionally, we talk about postpartum blues, we talk about postpartum depression, and we talk about postpartum psychosis. But however, there are an array or a spectrum of psychiatric disorders that are existent in postpartum period. For today's lecture, we'll concentrate only on these 3 aspects. What are postpartum blues? Postpartum blues are usually mild, self-limiting condition where the client has crying spells, she has difficulty in bonding with the child, but it is usually short-lived for about a week or so maximum, and it resolves on its own. What is postpartum depression then? In postpartum depression, the symptoms becomes persistent, it becomes pervasive, and the emotions becomes predominant. The lady has enormous crying spells, sadness, loss of interest, easy fatigability, has difficulty in bonding with the child, has excessive crying spells, might be having disturbances in sleep and appetite. Now, occasionally, some of these symptoms can exaggerate along with other psychotic symptoms like delusions, hallucinations, confusion, aggression to an extent of harming the child might set in, which we call it as postpartum psychosis. Now, all these conditions are definitely existent in postpartum period, and they have to be treated and managed optimally so that there is no repercussion to both the mother and the child. Whenever you see any emotional changes in a postpartum women, kindly meet your mental health professional and understand the needs, because they will have long-term repercussions on both the mother and the child. Thank you.